Dr. GPT is a ChatGPT tool by OpenAI, which is a patient facing resource in which anyone can interact or chat with it, receiving the information. It was created for the purpose of assisting normal people, not clinicians, in health issues or tasks such as reading labs or an MRI result, as well as dealing with small ailments through advice, potentially lowering unnecessary trips to the ER. To simulate a patient interaction, we will pretend we are a 30-year-old female named Jen who's experiencing UTI symptoms and takes to Dr. GPT for advice. As we saw in the video, Jen entered her age, sex, and symptoms and received an extensive output with a differential diagnosis, different treatments with specific names, and when to seek emergency care. She also asked a follow up question about how frequently she has these symptoms and how to get a faster diagnosis and treatment. Dr. GPT outlined ideas to confirm, potentially seeking help at an urgent care or getting on a plan at her family doctor's office. It also gave holistic treatments for Jen to try in the meantime. Third, Jen asked when she should see a doctor. The tool did encourage Jen to seek medical care and outlined specifically when to in an emergency situation, and outlines what she would experience at the clinic once seeking care, possibly alleviating her anxiety with demystifying the process. In my opinion, the tool did a good job giving an outline of a clear next steps in an easy to follow bullet point format. Additionally, other researchers have found that those experiencing frequent UTIs also found satisfaction and relief while using this tool. On the other hand, the output gave many differential diagnoses, including sexually transmitted diseases, which may not have been necessary. It also had an interest in fine tuning diagnoses, and it gave specific treatment options with specific names of antibiotics. And this could be problematic because some UTIs need to be treated in a specific way, as some bacteria are not susceptible to certain drugs, and an upper versus lower UTI require different treatment plans. For example, fosfomycin versus ciprofloxacin, respectively. Although the tool recommended seeing a doctor, it never stated its own limitations or expressed the fact that it is not valid medical care nor able to give valid medical advice. A 2024 study with urologists examined OpenAI answers and determined an average quality score of only 3 out of 5, with only 63% of answers rated as satisfactory. Other studies found similar rates as this, which further emphasizes the need for the tool to express its limitations to its general audience. I would mention this tool to my family and friends because it's pretty neat to give such complicated symptoms and questions and get pretty detailed answers. However, I would advise them to use it only as a supplementary or additional resource to confirm or reassure things already told to them by a health professional. I would put strong emphasis on the fact that this is not medical advice and cannot replace medical advice and may pull from flawed data sources, and to always seek care and advice from your physician. All in all, Dr. GPT shows great promise in helping people navigate their health anxiety and symptoms, especially for smaller concerns. But the tool needs to be transparent about its limitations and remind people to always seek professional care.